remember as a third-year medical student at WashU, sitting in their morning conference and really just in awe of the knowledge of the residents.
We're probably the most well-rounded residency program in the country when you think about hands-on operative experience, the academics, research, as well as our lectures and didactics.
You are going to learn to think like an orthopedic surgeon. You're going to learn to operate like orthopedic surgeons should learn and should operate. And you're going to be confident but not cocky in your ability to render effective care in which you can be confident as a surgeon for your patients.
At WashU, we have faculty in all subspecialties. Not all residency programs have that. Not only do we have faculty in all subspecialties, but they're all doing great things in their fields.
You want a program that can provide you excellence in every facet, every subspecialty. If you want to be a hand surgeon, fantastic. We have the president of the Hand Society. If you want to be a spine surgeon, great. The classification for scoliosis was generated here. And when you put all of that together, you understand that as your course pivots and shifts, as you grow as a person, as you grow as a surgeon, those opportunities grow with you.
Our department really has taken a forefront on using technology and helping with patient care. We're always trying to make advancements, always trying to improve, and trying to find the newest technology to do that. We can use our hands and build our technical skills, even if we don't have a patient right in front of us.
The biggest advice I can give to applicants is be genuine, be yourself. We're looking for good people that are going to come in here and take the most of the advantages that we give them.
And as you grow and as you change, this place will be here to provide you opportunities, to provide you support, and to help you be the best surgeon, person, physician you can be.